I got my degree in electrical engineering, but then I gravitated towards biomedical engineering and did research in biomedical engineering. And that sort of pushed me into doing medicine. I went to medical school. In medical school, I really got interested in surgery, so I trained in general and vascular surgery. And I've been doing general and vascular surgery for the last 30 years. And the last 8 years, we've been doing more modern and advanced vein procedures. Well, when a patient comes here, you know, we review the history and find out what kind of symptoms they've had, what's developed, their pregnancies and all of this, find what the family history is, and then we do a physical exam and we get an assessment of what's going on, and we make a preliminary diagnosis of which veins or what veins are doing what and so on. But we follow that up with a thorough ultrasound evaluation that helps us to really see where the culprit veins are, the veins that are really causing the damage. And then together with the physical and the ultrasound evaluation, we sit down with the patients and we come to a treatment plan, what is most consistent with the findings, with the patient's wishes and expectations. It makes you feel so great when the patient comes back and says now they can live a normal life. You know, not only does treatment of the varicose veins get rid of the pain that so many of the people experience with their daily activities with working and standing, such as nurses and teachers and so on. They're standing all day. They have a lot of pain, a lot of discomfort. By the end of the day, they're tired and they don't want to do anything anymore. Just some of these simple procedures just changes their lives all around. And then when you take away those embarrassing veins, it also changes their lives socially. They're able to wear shorts again. They can wear swimsuits. They wear elegant attire. They just feel great. And it really is gratifying to hear these stories from my patients. The main stay of treatment these days is going to be the ablation treatment, the ablation of the greater or short saphenous veins, which takes away the most common underlying vein condition. And that's done two ways, and we can do it in both ways. We can do it with the laser or the radiofrequency device. Following that, we usually take care of the residual visible and painful varicose veins, and these are the big truncal varicose veins that we see on the legs. And these are taken out by a procedure called ambulatory phlebectomy. It's a procedure whereby we remove these veins with little tiny incisions. We use a surgical device that looks like a crochet hook, and we tease these veins out of these areas, all done under local anesthesia, all done on premise. So there's no need for the hospital, for an anesthesiologist or anything like that. And this gets rid of all the major visible larger veins. And in addition to that, after we're done with the major issues, then we can address the problem of the spider veins and the residual visible veins were too small to take out in that manner. And these we treat mainly by sclerotherapy, which is injection of a little chemical irritant inside the vein that helps cause the vein to close. The staff is really remarkable in the way they're able to accommodate the patients to their schedules and can get them in whenever it's most convenient for them. My staff is so good at getting insurance coverage. The patient is very gratified that we can get approval for the vast majority of the cases from the insurances. And I think those are really good reasons. I think that the reason they should choose me over other facilities is because we do a very comprehensive approach to the veins here. We do a comprehensive workup to make sure that we take care of the real cause of the problems, not a superficial approach where we just treat something that we see on the surface without investigating the underlying cause. And then we can offer everything that's available as far as treatment on veins. We don't just do spider veins, we don't just do the laser ablation, we do it all so that we can take care of the entire vein situation, vein problem on that patient, not just part of it. My goal is just to make our patients happy